Welcome to the Certified Kinesio Taping Practitioner. What is it? What do they do? And how can I become one? Webinar by Ashley Sneeder and Paige Splickriver. As the title states, this webinar addresses what a Certified Kinesio Taping Practitioner is, what they do, and how you can become one. Please use the QR code on the slide to access the handout for this webinar. Make sure to copy the information on the handout and paste it into a new document to put your answers on, so when others access the handout, answers are not shown. Have you ever seen clients with kinesio tape on or used kinesio tape with a client? Occupational therapists, physical therapists, and other healthcare professionals use kinesio tape to address a variety of injuries, disabilities, and other health-related concerns. By the end of this webinar, you will have learned what kinesio tape, like in these photos, can be used for in occupational therapy and how you can become a certified kinesio taping practitioner. We will address 5 lesson objectives through this webinar. First, the learner will define KT taping within the OT profession. Second, the learner will identify 3 uses of KT taping within OT services. Third, the learner will summarize the pros and cons of KT taping within OT services. Fourth, the learner will interpret the overall view of KT taping in OT based on evidence. Finally, the learner will prepare a plan to become a certified KT practitioner. At the conclusion of the webinar, the learner will complete a brief survey quiz to check if the learner met the objectives and what they have learned through this webinar. This webinar uses activities and videos to share information and address the objectives. We will first address Objective 1, what is kinesio tape, with this video that briefly introduces KT tape.
What is kinesio and kinesio taping? In the 1970s, Dr. Kinzo Kase was searching for a way to help the body's natural healing process and prolong the benefits of his treatment after his patients left his clinic. He then developed the kinesio taping method along with his specially designed tool, Kinesio Text Tape. Kinesio tape is the original elastic adhesive tape. When applied with the rehabilitative taping technique, the kinesio taping method, it provides support and stability to muscles and joints without restricting the body's range of motion. The buildup of lymphatic and other bodily fluids can cause discomfort and inflammation. Kinesio tape alleviates discomfort and helps fluid drainage by microscopically lifting the skin. This lifting effect reduces pressure and inflammation and allows for fluids to flow in and out of the kinesio taping area. Because of its popularity with Olympic and professional athletes, many people think it can only be used for sports. Kinesio tape, along with the kinesio taping method, can be used to treat ailments from pediatrics to senior citizens and everyone else in between. Kinesio tape today is used in hospitals, clinics, and athletic training rooms. But you'll also find it on your local handyman, the new mom, and your yoga instructor. Kinesio tape is a perfect fit for work, for life, as well as for play.
As the video mentioned, KT tape was created by Dr. Kinzo Kase in 1973 to prolong the effects of physiologic work done on clients. KT tape is made from a latex-free, hypoallergenic cotton fiber with an acrylic heat-activated backing to ensure it sticks to the individual. The tape is designed to stretch about 40 to 60% compared to its resting length. The tape is lightweight and thin as it was designed to mimic the weight and thickness of skin. For the purpose of this webinar, we are going to define KT tape as an elastic sports and fitness tape designed for muscle, ligament, and tendon pain relief and support. You will now complete the first activity, defining KT tape. At this time, pause the webinar and take a couple minutes to create your own definition of KT tape and record it on your handout.
We will now address Objective 2, KT tape's use in OT. KT tape is utilized by many OTs as it provides many benefits such as pain relief, reduction in inflammation, enhanced recovery, support, increased mobility, and increased posture. The elasticity of the KT tape helps to carefully lift the skin from the tissues below. When the skin and tissues separate, more space is left for blood and lymph to flow, which helps to alleviate pressure and reduce swelling and pain. The increased flow of blood, oxygen, and nutrients help to enhance the healing process. This process is also said to result in decreased stiffness and increased mobility of the muscles. The spaces that are opened by the KT tape also house nerve receptors that send signals to the brain. If KT tape is applied appropriately, the nerves send feedback to the brain that results in improved posture. The first video we showed briefly explained how KT tape works. We want to share part of another video that further explains 3 ways the KT tape works.
I teach my patients that there are 3 ways that it helps. The first is by helping with inflammation. How does it help with inflammation? You see, our skin, we can see the outside of it, but we're actually built kind of like lasagna. Lasagna's got those noodle layers, and in between the noodle layers is red sauce, right? Some meat too. That red sauce, we're built exactly the same way. So we have our epidermis and our dermis, subcutaneous layers, fat, fascia, layers that go down to our muscle. And in between those layers, it's fluids, like lymph and blood, right? Kinesiology tape, by attaching to the skin, as we move back and forth, it helps to pull those layers of lasagna, those noodle layers apart. And by doing that, allow for better fluid exchange. That helps to reduce inflammation in an area. The second way that it helps is by reducing pain. And I'm going to drop down into a little bit of neurology here, but, and it's cool. I'm a nerd. So neurologically, the receptors for touch in your skin, those receptors fire back to your spinal cord inhibitorily, meaning they dampen or silence, help to silence the signals coming in from your C fibers. Your C fibers are your pain fibers. So you know this from when you would, let's say, hit your hand as a kid, and your mom would come over and she'd rub it. Maybe your dad would come over and rub it like this. And they were doing that not because they knew neurology, but they knew that their parents had done that for them, and that reduces the pain, right? The exact opposite happens if you wanted to feel more pain. You hit your hand and then you keep it completely still and just stare at it. That would heighten your pain awareness. So by putting the tape on there, as you're moving back and forth, you're stretching those cutaneous receptors, firing them. They fire back inhibitorily to your spinal cord at the C fibers, the pain fibers, and therefore dampen, decrease the pain perception, right? Does it take it away completely? Not usually. Does it take it away significantly so that you can notice it? Most of the time. That's pretty cool. Number 3 is it allows us to cue the body into a better biomechanical position. So if you were someone that, rounded your shoulders like this, and I was to come up and say, tapping here, bring your shoulder back, you could do that, right? I didn't push your shoulder back. I just cued you and I gave you a reminder. You bring your shoulders back. The tape can act the same way. If we put the tape on to help you move into a proper position, then that can help you biomechanically to reduce pain in your body. Pretty awesome. Lastly, I get asked, is there something in the tape that is actually giving us properties? Is there a medicine in there or something? No, there isn't. That's all just based on the principles of how the tape moves and how it affects your skin and how it's applied. What the tape does have is a specific weave. If I tear the back of the tape here, you'll notice that it stretches a little bit and then it reaches an end stretch where it doesn't actually stretch anymore. That's important. When you look at like white athletic tape that we think of when back in the day when we tape someone's ankle, that white athletic tape has absolutely no stretch characteristic to it at all. And some other tapes, maybe even wraps like A-strap and things, they kind of almost have an unlimited amount of stretch. But Kinesio tape It comes to a certain spot and then it stops. So it's that ability for it to stretch, but then have an end point to its stretch that gives it its principles and how it works physiologically with your body.
The 6 concepts or types of corrections of KT taping are mechanical, fascia or facial, space, tendon and ligament, functional and circulatory or lymphatic. The first concept, mechanical corrections, are focused on improving stability and biomechanics. The second concept, fascia or fascial corrections, are used to create or direct movement of fascia. Space corrections, the third concept, are used to help decrease pressure over specific tissues in the body. Tendon and ligament corrections, the fourth concept, are used to help decrease stresses on ligaments and/or tendons. The fifth concept, functional corrections, are focused on providing sensory stimulation in order to stimulate and assist or limit particular motions. The sixth and final concept, circulatory and lymphatic corrections, are used to assist in lymphatic fluid flow. It is important to know when to not use KT tape. Taping over an open wound may result in an infection developing at the wound site. KT tape helps to increase blood flow, which can dislodge a blood clot and potentially be fatal, so do not use KT tape when blood clots are present. It is not appropriate to use KT tape with a client who has active cancer, as the increase in blood flow to the cancerous growths can be extremely dangerous. It is not appropriate to use KT tape if a client has had a lymph node removed, as an increase in blood flow to an area where a lymph was removed can lead to swelling. Individuals with diabetes may have reduced sensation, which can be dangerous with KT tape use, as the individual may be unaware of a reaction to the tape. Individuals who have known allergies to adhesives should not have KT tape applied to them, as reactions could be triggered by the application of the tape. Finally, if a client has fragile skin, their skin could tear when removing the KT tape. You will now complete the second activity, additional uses of KT taping in OT. Research on your own or go to kttape.com and click the How to Apply KT Tape tab at the top to see application videos for a variety of KT tape uses. We have provided a screenshot of the video options on the KT tape website. At this time, pause the webinar and take a couple minutes to research and see if you can identify additional uses for KT taping in OT. You will now complete the third activity, what diagnoses can KT tape help with? At this time, pause the webinar and take a couple minutes to brainstorm or research diagnoses that KT tape can help with and jot them down. Some examples of diagnoses that KT tape is used with are stroke, arthritis, tendinitis, and unspecified pain. Please note that these are just 4 additional examples, and there are many other diagnoses KT tape is used with.
Before we address the pros and cons of KT tape, please pause the video and complete the pro-con chart on your handout to the best of your ability with the statements you see on the screen. Please note that not all statements will be used, and the pros and cons do not include the benefits of KT tape already addressed in the webinar. We will first start by discussing the pros identified with KT tape use. KT tape has minimal side effects compared to other possible interventions, treatments, or medications. KT tape can be worn for multiple days at a time, which provides constant therapeutic benefits while the tape is on. Clients and their loved ones can be educated or trained by the OT to apply KT tape on their own at home to keep up with a KT tape regimen. KT tape is also affordable if clients wish to purchase tape for themselves to continue applying when necessary. The final pro we have identified is that KT tape can be used with most other interventions, but it is important to note that KT tape may not be appropriate for use with all other interventions. Moving on to the cons of KT tape. KT tape is not reusable, so every time it is removed, it must be thrown away. Although KT tape can be worn for multiple days, frequent reapplication is necessary for long-term use of KT tape. KT tape can occasionally be painful to remove, for example, if the tape is over hair on the body. The final con we have identified is that skin irritations can occur with continued use of KT tape, especially with continued removal. Please note there are additional pros and cons of KT tape not addressed in this webinar. At this time, if you haven't already, pause the video and make corrections to your pro-con chart if necessary.
You will now complete activity 5. What is the overall view of KT taping in the OT profession? Please pause the video and take a minute to think to yourself or quick research what you think the overall view of KT taping is in the OT profession. What does the literature say? Does it support or not support the use of KT tape in OT? After reading through several studies, we wanted to summarize a few of the findings that we found. A double-blind, placebo-controlled clinical trial was conducted by Huang et al. In 2017 to investigate the effects of kinesio taping for stroke patients with hemiplegic shoulder pain. A total of 21 stroke patients with hemiplegic shoulder pain that began within 6 months following their stroke were included in the study. Inclusion criteria for the participants include unilateral ischemic or hemorrhagic stroke lesion confirmed by computerized tomography or magnetic resonance imaging. First incidence of stroke with onset less than 6 months prior to discharge, pain in the affected shoulder, and adequate communication ability and intact cognitive function. Exclusion criteria for participants include shoulder pain or a history of surgery in the affected shoulder before the onset of the stroke, skin problems, wounds, or infection on the affected shoulder, experience of using KT tape, or a history of allergy to KT tape. A conventional rehabilitation protocol and therapeutic kinesio taping intervention took place over a 3-week period for the experimental group. The experimental group consisted of 11 participants. The control group, consisting of 10 participants, participated in a similar conventional rehabilitation program and sham kinesio taping intervention. The rehabilitation program included both physical therapy and occupational therapy sessions. Sessions were 60 minutes per day for 5 consecutive days each week. The participants were evaluated on a numerical rating scale score, shoulder pain and disability index, ultrasound findings, and pain-free range of motion of the affected shoulder, both before and after the intervention, to identify if changes were made. Outcome measures included pain intensity on an 11-point numerical rating scale, ultrasound examination, musculotendon pathology, subacromial distance, and pain-free passive range of motion of the shoulder. The researchers found that after 3 weeks of kinesio taping intervention, pain levels reduced in stroke patients who have hemiplegic shoulder pain. It also improved shoulder flexion and shoulder internal and external rotation in the stroke patients. The overall conclusion of this study support the use of KT tape in stroke patients with hemiplegic shoulder pain for increasing mobility and decreasing pain. The photo you see at the bottom right of the screen shows the kinesio taping method for the study group on the left and the sham taping for the control group on the right. The second study that we want to talk about is one by Kim et al. From 2014. A study was conducted to evaluate the changes in function and balance after kinesio taping application in stroke patients. 30 post-stroke individuals with hemiparesis were included in the study. Participants were randomly assigned to the experimental group or control group. The control group engaged in therapeutic exercise without KT tape application, while the experimental group engaged in therapeutic exercise after KT application. Interventions occurred 3 times a week for a 6-week period with measurements both before and after interventions. Application of the tape was completed by a physical therapist using a 5-centimeter wide elastic kinesio tape. Tape was applied to the major parts of the affected leg, including the quadriceps femoris and tibialis anterior. Tape was also applied to the affected upper extremity, specifically to the biceps brachii and muscles that upwardly rotate the scapula. The functional gait of the participants was measured with the straight line walking test. This test requires the individual to walk forward in a straight line approximately 10 meters away while blindfolded to assess the amount the individual veered from the line with the angle between the starting and ending position. The Berg balance scale was also used to evaluate dynamic balance. The 10-meter walking test was used as well. The results showed a statistically significant difference in the test results in the experimental group only. Therefore, the researchers determined that applying tape to the affected side of a stroke patient has a positive effect on improvement of gait and walking speed. You will now complete activity 6. What does other literature say about KT tape in occupational therapy? Please pause the video and take some time to locate 2 articles, one that supports KT tape and one that does not support KT tape. As you search for your articles, be aware of the overall findings or conclusion of the literature regarding the use of KT tape. Does it generally support or not support its use in OT?
We will now explain the steps to becoming a certified kinesio taping practitioner. There are 4 total steps to becoming a CKTP. The first thing you will need to do is register at kinesiotaping.com using the link provided at the bottom of the screen. Once you are registered, you must purchase and attend various taping seminars before taking your CKTP exam. Once you have completed and passed the CKTP exam, you must maintain your certified kinesio taping practitioner membership. We will now discuss the requirements for becoming a certified kinesio taping practitioner. As you can see, there are 6 total requirements: making an account, achievements, seminars, passing the exam, a license agreement, and maintaining membership. Individuals interested in becoming a certified kinesio taping practitioner must first make an account with kinesiotaping.com. Individuals must have achieved or be in either their junior or senior year working towards the approved credentials listed on the kinesiotaping.com website. Individuals must complete kinesio taping assessments, fundamental concepts and techniques, and advanced techniques in clinical reasoning approved seminars. Once the seminars are completed, the individual must score an 80% or higher to pass the CKTP exam. Once the individual has passed the exam, he or she must sign the CKTP certification mark license agreement. This agreement is used to protect the CKTP credentials of practitioners and ensure the credentials are only used by individuals who are certified kinesio practitioners. The agreement also assists the individual in promoting their clinics, practice, and expertise in the kinesio taping method. Finally, an individual must maintain the KTAI annual membership to stay up to date on news, advancements, and research on kinesio taping. We now have a quick video here from kinesiotape.com that shows what the KT seminar and classes are like. As you can see from the video, the classes and seminars provide lots of hands-on opportunities to learn and practice the KT taping methods. You will now complete the final activity. What Kinesio taping seminars are available? Pause the webinar and go to kinesiotaping.com. Hold your mouse over the drop-down arrow next to certification at the top of your screen and click Become a Certified Kinesio Taping Practitioner. Next, click the blue box on the right of the screen that says Review all available seminars. Explore the seminars available and record ones that look interesting to you on your handout. Congratulations, you have finished the Kinesio taping webinar. Please use a QR code in the center of the slide to access the Google Forms survey to test your knowledge on Kinesio taping. We ask that you complete the survey without checking or referencing notes to see what you have learned. You will be able to see the correct answers after completing the survey. Thank you for watching our webinar.